Mark Daly for Paralyzed Veterans of America News Online, reporting from Summit 2011, and with one of the presenters, our very own Mark Lichter, who is Director of Architecture at Paralyzed Veterans. Flipping to Mark. Hi Mark, how are you?
I'm well, thank you.
Good.
Glad to be here.
It's great to see you, and I'm not going to ask you about that black eye, but
at least there's plenty of clinicians around to help me out.
That's definitely a good catch, that, yeah. Just want to talk to you about what you're doing here, Mark, because people might say to themselves,
Sure.
You're watching this video podcast, why on earth is an architect here at a health summit? So why are you here?
Well, our particular presentation is our role in working with the VA to produce exemplary spinal cord injury centers. And what we do is we work with the VA to ensure their spinal cord injury centers, both inpatient and outpatient facilities, are as accessible as possible, and that they help the patients with their rehabilitation through the architecture. It promotes the independence of the patient. So the architecture is designed so that the patient relies less and less on the staff. They can push themselves physically, and the means are there so that they can rehabilitate independently if at all possible.
Well, I know one of the things that you do, 24/7 with your staff is to try and make America more accessible. What would you say, we were just listening earlier to Bill Lawson and Homer Townsend talking about, 65 years of changing America and making it a better place for people with disabilities. A lot of progress has been made on the goal of accessibility, but I know there must be still lots of barriers there that need to be torn down by organizations like Paralyzed Veterans. Tell us about sort of the biggest challenges facing you and your team at the minute.
Sure. Well, Paralyzed Veterans of America started in their inception with working with the New York chapter of the American Institute of Architects, and they wanted to provide accessible housing for the veterans coming home. And we've come a long way. The ADA came along, and people think that now the work is done. Turns out that the work isn't done. Enforcing the ADA, making it better, it's an ongoing process. As you can talk to anyone who uses a wheelchair or with any disability, society is not fully accessible, and we have a long way to go.
I know that there have been a lot, and this again sort of goes back to what Paralyzed Veterans of America does in a sort of seamless approach to dealing with accessibility issues. Because I know that in our Government Affairs Department they fought very, very hard for the ADA amendments, because of course over the years, just for the benefit of the viewers, the ADA had been interpreted by a variety of courts in a way that was rather different from the very broad definition of disability that was intended in the original legislation. So I know that the ADA has been sort of strengthened fairly recently again, but I suppose that that's just the basic part of it, isn't it? I mean, there's a lot more to it than just a law, following the law, right?
A real good example of that and how far we still need to go is that the ADA says that a person, whether they have a disability or not, should have access to a public accommodation, to a building. That person doesn't necessarily have the way in that their family and friends do, and so what we want to see is a holistic, a full approach where everybody has the same route into a building, into a public accommodation. That person isn't separated from their family or friends in order to get in along a narrow ramp. Everybody takes the same route in. That's a good example of. So
I suppose in a way what you're saying is that you want accessibility to be family friendly. In other words, if there's a person who is a person with disabilities, and they have an able-bodied family, so to speak, that they should be able to access anything in the same way as the rest of their family.
Oh, absolutely. It's about their family, and it's about it's a civil right that people with disabilities should be treated the same as people who are ambulatory.
Well, Mark, I'm asking this question of everyone that I'm interviewing at the summit this weekend. Let's say that we had a Paralyzed Veterans of America time machine, and we could jump into that time machine right now and go forward 10 years into the future. What would you like to see when we get out on the other end in 10 years' time? What sort of advances would you like to see as a leader in the area of accessibility for people with disabilities?
Well, what I would like to see and what we are working very hard to achieve is a fair and equitable environment for everyone. It's really that simple. When people look at buildings, when they look at access to facilities, we want to see that everybody is treated the same. It's that simple.
Well, on that very simple but nevertheless visionary view, Mark Lichter, Director of Architecture at Paralyzed Veterans of America at Summit 2011. Thanks, Mark.
Thank you.